When I was a postgraduate, the sensitization or awareness of this rare disease was very rare, and of course it's rare even now, but it's improved a lot. So lot many focused programs, lot many sensitization programs, patient advocacy programs are happening. So you come across certain individual groups where they work on it. Earlier it was the difficulty of the diagnosis. So it was the clinically we would rely upon lot many things, and now the diagnosis part has become little easier because of the sensitization. The need for the diagnosis is well defined now, and the scale, the thing which helps with having the diagnosis also is defined. Knowing the diagnosis, you know the spectrum of mutation, then look at the precision medicine, or at least predict the phenotype care, continuum of care. Yeah, so again, as I said, I would say the problem load what is there in India is huge. The work what is done in India as a solution for this is very less. So the problem what we are facing is we are not probably sensitizing the group for the need of a focused program. See, what is an average time taken by a patient to get to know the diagnosis? What is an average time, or what is the average number of doctors they visit before coming to know the diagnosis? For example, in the disease what I see, the average number of physicians they meet before knowing the diagnosis is around 20. It might be 15 to 20. Average time taken for the diagnosis itself is like 2 to 5 years minimum. Earlier, before I joined, it was even bigger. The number was bigger. The average time required for diagnosis would have gone to 10 years. By the time most severe cases, most least number of cases would have either come out of the picture to interest to know the diagnosis also. So having said that, it is about the need which is well defined. The reason for doing this diagnosis continuum of care also, that early intervention in these rare disease will actually reduce the severity of the phenotype. You know what it is, and certain mutation specific treatments, if there are any, will always be suggested by the clinicians. Yeah. It's a very rare, occasion. I'll tell you, I'm a dermatologist. I've gone to a couple of conferences where aesthetic part was the focus. I'm an aesthetician also. So fillers, Botox, laser reduction, body contouring. When I present or when I discuss in the panel, it is to have a very milder intensity. But this one, I think, after a long time I felt the stage fear because this is an intense discussion which happens. The moment you tell one word, all your patients come into picture, or parents come into picture, their difficulties come into picture. So it's a very intense discussion which happens here. So I would say many such focused programs in a very productive way has to happen, and that is a dire need for our Indian scenario also. So definitely a lot of collaborations. We never know that we exist, and we never know that some nerds of this rare disease also exist who always get addicted to the work they do. A good platform to get to know each other, work for the patient-centric programs. No, it's a good thing that I would really love to have a lot of clinicians involved, because they are first responders. Parents, clinicians should be high in numbers actually, rather than let me be very honest. All this rare disease, children don't ask for gene therapies, don't ask for any high-end treatments. They ask for the equality in the care. And equal in the care, how they are treated in this focused institutes are different. How they have to cross 20 doors to get into the major picture. 20 different physicians, or to come to know the diagnosis. Imagine someone from our family would have had 20 doctors. How many kilometers they would have traveled? How many? Again, the focused program is the way to go. That solves most of the problems. We know what is the burden of an Indian scenario, what is the magnitude of the disease, because any policy making, we need to know the prevalence and incidence. That is not there. And for one rare disease, multiple problems are there. To see get a ear testing, they have to travel some 20 kilometers. To get a heart testing, they have to travel. See the amount of travel that can be reduced when you have a focused multidisciplinary care. So all these pictures, having one, I think, and be it our central institutes are burdened. They have so much to take care, and their plate is full. It's not easy for them to answer every query. ICMR, AIMS, you see the pattern in their working. It's so huge, and so number of rare diseases that has to be handled, and that intent. So decentralizing the care for rare disease with a specific institutions would be really good for the focused productive work. This is the thing which I want to conclude with. Thank you so much for Indo US Rare organization. God bless you all. So that's what I try to tell. It's a very focused. We don't lose focus, and we learned a lot of ifs and buts, and what are the limitations what we have. So collaborating with us, it's knowledge what already they have will be always transferred, so that it will reduce our burden of again devising the same plan. They have done this before. They have traveled that path earlier, and they have seen what are the difficulties they have faced before. And it's always better to collaborate with them, so that you can inculcate a lot of things in order to reduce your effort in taking care of rare disease. Let me always be honest. We are also rare, and the disease is rare. The patient's problem is rare. We have to protect ourselves by strategizing in the way we need to work. We shouldn't burn ourselves because if not for us, I don't think many people are also having that intent to work. So it's always having patient-centered program. You should also keep yourself in that list and protect yourself. Yeah.